Gives me great pleasure now to introduce Nora Super. Nora Super, in July of 2014, was named the Executive Director of the 2015 White House Conference on Aging. We're very pleased that she could be here today. Prior to that, she served in a leadership role in the United States Department of Health and Human Services Office of the National Coordinator for Health Information Technology. Before joining federal service, she served as the Director of Federal Government Relations, Health, and Long-Term Care at AARP. She's worked in academia and in the private sector, including George Washington University Medical School, the National Health Policy Forum, the Washington Business Group on Health, and Employee Benefit Research Institute. I don't know how you've done all that. An amazing portfolio. She's a native of New Orleans. She studied political science at Tulane. It gives me great pleasure to introduce Nora Super.
Thank you, David, and good morning, everyone. It's a delight to be here. I, too, am sorry that Gal could not be here. We had great conversations leading up to today. I love to come to New York. My daughter is at NYU, so I get an opportunity to come. I often say my daughter and all my money go to NYU. Know anything about their tuition, certainly what it costs to live in the city. But it is always fun to come visit and feel the excitement in the air in New York City and all of the people here. It's so great to see so many of you all out there. I thought I'd tell you a little bit about myself other than my professional accomplishments, and apparently I changed jobs a lot. I can't keep a job, but other than that, I do have personal reasons that I came to this job. And as many people in this room do, and everywhere I go, I'm struck by how aging is affecting all of us. And I'd like to tell a story. As David mentioned, I'm from New Orleans. My husband turned 60 last year, and he didn't want to have a party. And I'm from New Orleans, so I think you should have a party for everything, certainly when you turn 60. And, you know, I told him my mom died at the age of 52. And, you know, that was a very profound loss in our family, of course, and made me realize how important it is to celebrate every year that you get here, and to remember that getting older is really a good thing, and the fact that we're living longer and we're living healthier lives is really something that we should celebrate. On the flip side of that, my dad had Alzheimer's disease, so we saw the other side of aging, and all of my siblings and I all had to pitch in and help care for him. But what was most remarkable, my dad was a physician, he had a pension, we had financial resources, so that wasn't something that we worried about. But even in my own family, my aunt, who was a piano teacher, also had Alzheimer's. She had no kids, she had no pension, and the resources that she had were way different than my dad. It just really brought home how important supportive services are to folks who need them, and how we really couldn't have helped care for my aunt without the programs that you all work in each and every day. So this is a very personal issue for me, something I feel very strongly about. I thought I'd tell you a little bit about the conference and what we're planning. As I go around the country, I talk about the 3 C's. So we have conversation, celebration, and change. So this is the conversation. Hopefully I'll get to hear from you all. I've been going all around the country, listening to people, hearing their ideas about what we can do for this conference on aging. Of course, we also want to celebrate all that older Americans contribute to our country, but also this year has many exciting anniversaries that we need to celebrate. It's the 50th anniversary of Medicare, the 50th anniversary of Medicaid, the 50th anniversary of the Older Americans Act, the 25th anniversary of the Americans with Disabilities Act, and as someone reminded me too, it's the 5th anniversary of the Affordable Care Act. So there's a lot to celebrate this year. But we also want to change the landscape for aging. I don't have to tell you all that our country is changing dramatically in terms of the demographics. Literally 10,000 people a day turn 65 in this country. And this isn't just a one-time change that, you know, baby boomers will get older and then we'll go back to the way it was. This is a permanent shift in our societal structure. And as a country, we need to look at the ways that we can change how we're changing, the demographics are changing, and be better prepared, and embrace all that older people bring to our community. So let me answer the first question. I've already gotten it several times, so I'll say we don't have a date yet for the conference. We are working on it. I mean, the exciting news is that the president really wants to come, the vice president really wants to come. That makes it hard sometimes to find a date when everyone's available and with a space. But we are working on that. We're looking at this summer. We're hoping to do that. I thought since many of you all probably know a little bit about the White House Conference on Aging, I'd give you a little background about how this year's conference is different than the past. You may know that we've had a White House Conference on Aging every 10 years since 1961. I've even identified someone who attended the 1961 conference, and I hope to have them at the State of the Union. You know, when people say places where you see all the speeches and everything, you hope sometimes the things that you put in there will be in there. Unfortunately, we will not be able to have the gentleman there, but I hope that he will be at the White House Conference on Aging. You're probably aware that Congress has not reauthorized the Older Americans Act. The good news is they're working on it. I mean, really working on it. This may be the first bipartisan bill passed in this Congress. So for those of you who really care about the Older Americans Act, which I assume is almost everyone in this room, please urge your members of Congress to pass it. We know it's long overdue. But right now we don't have the reauthorized Older Americans Act, and even the bill that's pending doesn't provide a form and a structure for the White House Conference on Aging. So this year's conference will be a little different. We're seeking broad public engagement, but we're not going to have a formal delegate process like we've had in the past. We're not going to have a formal advisory committee or a policy committee. There won't be resolutions that we'll be voting on at the conference. But we're looking at new technology and new media in a way to allow everyone to participate wherever they are. And I'm really excited about this change because, you know, even when I talk to my predecessors who've had this job in the past, they'll talk about ways that they communicated, especially under President Clinton's administration. And, you know, many of you may know Bob Blancato, who's the executive director then, and he will talk about how they faxed something to the secretary or to the White House, or how everything would be sent by messenger. Remember those days? Like, we don't do that anymore. You just hit a button and you can reach literally millions of people. So we've been getting comments on our website. Hopefully you all have visited our website. It's www.whitehousecongov.gov. It's not very catchy, but easy to remember. We put regular updates. I really encourage you all to sign up for that so you know what's going on and get to see new opportunities. And what's so exciting about the conference is we're bringing together all levels of government across the federal government, all the agencies that work on aging, and talking about ways that we can improve these services and products and work together. We announced last week that we'll be having 5 regional forums. We're going to be going to Tampa, Phoenix, Seattle, Cleveland, and Boston. We're going to live webcast all these events. I hope that people will tune in. And holding listening sessions, going around talking to people. And I have to say, all these sessions have left me with one overarching impression. That is, it's really time to shift the conversation from one that assumes that the coming age wave will overwhelm us to one that recognizes that it can help lift everyone's boats by tapping the power of experience to improve our communities and society. If you've been following us, you may know that we've identified 4 common themes that we'll be focusing on in this year's White House Conference on Aging. Our first focus area is preparing for financial security in retirement. As you're probably aware, a secure financial foundation was historically visioned as a 3-legged stool with Social Security, pensions, and savings and investments. Unfortunately, more and more Americans don't have pensions to rely upon anymore. And those options have changed. Fewer workers spend their careers with a single employer. So we have to look at new ways to have new sources of retirement security. I'm keeping my fingers crossed that this part of the President's speech tonight will include some of the exciting new proposals we have to encourage people to save more and give them more options. If it's not in his speech, it will definitely be in his budget. So I encourage you all to look at the budget when it comes out February 2nd. We've been working across the government, again, to look at ways to enhance and improve the services that we provide to older Americans. Our second focus area is healthy aging. And while we know we can't stop the passage of time, we know if we exercise, if we eat right, if we try to take better care of ourselves, we have a much better chance that our longer lives will be healthy ones as well. In addition to looking at prevention and management of chronic disease, we're looking at the built environment. We're working closely with the Department of Housing and Urban Development, as well as the Department of Transportation, looking at ways we can improve affordable housing and transportation options. New York City is always at the top of every list that you look at for places that people can age well, and a lot of that's the investment that the city has made in public transportation and options for people to be able to get from place to place. The third element in healthy aging that we're looking at, and is really exciting, is civic and social engagement. Again, with so many people getting older, they're looking for new ways to redefine success, what it means to be an older person in the United States, how to give back to society, how to create meaning and purpose to life. So we're really trying to connect many of the volunteer organizations, many opportunities where older Americans serve, and connect that with some of the services and supports that folks need. Of course, the third area is long-term services and supports, and I know I don't have to tell this group that it's critically important for people to get both good healthcare services and long-term care supports. Many people, as they get older, develop limitations and they need help. And I see that your vision statement says we need to ensure that resources are available in the right places for effective services for older adults. Well, we couldn't agree more. That's a really important issue that we're focusing on. We're looking at, as Corinda mentioned, there are lots of reforms and incentives that are in place under the Affordable Care Act and other initiatives that we're working with states and local communities to improve these services, learn from them, grow them, and try to find solutions to these challenging issues. And the fourth area that we're looking at is to prevent abuse, neglect, and financial exploitation of older adults. This is a really testament to many people in this room that have made elder justice a core issue for us to look at. As you probably know, the Elder Justice Act was part of the Affordable Care Act. We've had a coordinating committee that's been meeting since that was enacted. And now we have several proposals that we want to move forward. We want to make sure that we are able to protect older Americans who may be vulnerable to scams and others seeking to exploit them for financial gain. So that will be a core focus of what we're looking at, and we hope to get all of your input on how to move those programs forward. So in the coming months, we'll continue to engage in a national dialogue. As I mentioned, I encourage you to sign up for the website. We read each and every comment. We have people on our staff, on my staff, that look at this in each section, and we have a report out each week and hear what are we hearing, what are some common themes, and what are some things that we didn't expect to hear. And we want your voice to be part of that conversation as well. I'm really delighted to be here today, and I'm happy to take any questions that you may have, but most of all, just to say how much we are so, the most exciting thing about my job is going around to see people like you that are doing such great work each and every day. It restores my faith in what we can do as a community and move forward if we all work on these issues together. So thank you very much.